Hi everyone, my name is Dr. Alex George. I'm here with Dr. Monik Vasant today, who's a dentist and will be sharing some top tips around maintaining good oral health. How are you today?
Very well, thanks.
Dr. Monik, what are the main differences that you're seeing now compared to pre-pandemic in terms of people coming to the clinic and looking after their oral health?
Well, since the pandemic, we've seen an influx of patients seeking urgent dental care. So people who are having issues, they've broken teeth, pain, these sorts of problems where they couldn't access care during the height of the pandemic, they've come back in droves. What we've seen though is also an influx of people who are looking to improve the way their teeth look for whatever reason. There could be several driving factors for that, namely looking at the teeth on Zoom and these sorts of things. But what we haven't seen yet is a mass influx of patients seeking routine care. There have been many, but maybe not to the same extent as pre-pandemic. Now, there could be many reasons for that. One reason could be that people are struggling to still get access to routine dental care because of the increased requirements for extra cross-infection measures in clinics, like extra PPE, longer appointments to allow longer clean down. So these could be the reasons why some clinics are struggling to see people for as much routine care. Another reason also could be people are still wishing to stay away because they're concerned about COVID, or maybe they're shielding. So I think with time, we hopefully will see people returning for the very important routine checking visits so we can make sure that we prevent diseases from becoming ingrained in their mouths.
So Dr. Monik, what would you say are the main drivers for poor oral health?
Well, the two things that contribute the most to poor oral health are bacteria and poor diet.
A lot of people might have heard of this, 2 minutes twice a day, but why does it matter? Why does it need to be 2 minutes? For a layperson, why is that important? It could be 5, it could be 10, it could be 1 minute.
Well, 2 minutes is about the right amount of time to be able to thoroughly clean all the surfaces of a tooth. So the inside surface, the outside surface, and the biting surface, as well as getting around the gum line to prevent bacteria getting into the gums. So 2 minutes has kind of been thought of as a reasonable amount of time to be able to achieve that. Why twice a day? Because over the day, bacteria accumulate in the mouth, and food provides them with a food source, so they grow. So it's important that over the day, you at least brush a couple of times, whether that's first thing in the morning or last thing at night, which is the normal routine. This just prevents that bacterial load from getting too high.
Some people might find it a bit odd that actually the suggestion is that you should actually brush your teeth before breakfast.
Yeah.
When you get up in the morning, maybe not the first thing you want to do before you have your cup of coffee, but why is that actually important in terms of maintaining our health, oral health?
Well, brushing before breakfast and after breakfast, this is very much something that boils down to personal preference. However, most professionals suggest brushing before breakfast for the simple reason that immediately after consumption of some sort of food, the enamel may be slightly softer and more prone to abrasion and things like that. So for that reason, we tend to suggest brush before, get rid of the bacteria before you have a meal so they don't get fed.
It might surprise people. We can actually learn quite a lot about someone's overall physical health by looking in their mouths, can't we?
Yeah, ultimately, if somebody's going to be having things like fizzy drinks, a lot of sweets, a lot of sugars, we may see other signs of them having that sort of poor diet elsewhere in the mouth, whether it's increased weight, whether it's just heart disease, other issues, diabetes, all these sorts of things. But often, the mouth tells a story.
What top tips can you give people who want to improve their oral health?
Well, there are several things a patient can do, and many of them involve what they're doing at home. The first thing is brushing really well for 2 minutes twice a day using an antibacterial toothpaste like Colgate Total. Secondly, making sure they're using an interdental cleaning aid. So that means cleaning between the teeth to prevent things like plaque and food getting stuck. Lastly, making sure they reduce their sugar intake and fizzy drink intake a little bit. Not just the volume of fizzy drinks and sugar, but also the frequency of these things. Finally, they need to make sure they're going to see a dentist so that things like early tooth decay, gum disease, and oral cancer can get spotted, amongst many of the other things that can go wrong in the mouth.
So why do you recommend using a toothpaste like Colgate Total?
Colgate Total contains fluoride as well as an antibacterial. This means we protect not just the teeth, but also the whole mouth.
Thank you so much for your top tips on oral health. There's been some really useful bits of information in there.
It's an absolute pleasure.
Thank you.